Today I'm speaking with Dr. Debora Matthews, who's Director of the Network for Canadian Oral Health Research, about a session at next month's Pacific Dental Conference that the network is hosting. Welcome, Debora.
Thank you, John.
Could you tell us about this education session at the PDC that you're hosting?
I'm delighted to. Thank you very much for this opportunity. NCOHR is thrilled to be able to have this opportunity to present some Canadian oral health research to a number of dentists. We know the Pacific Dental Conference is a large conference in which we have over 10,000 oral health clinicians. Our session is entitled Opioids for the Management of Oral Facial Pain, Dispelling the Myths. The purpose of this session is to present the current best evidence on the use and misuse of opioids in everyday clinical dental practice. How this came about was NCOHR in late 2013 sponsored a workshop in Montreal for experts on orofacial pain management. A number of issues were discussed at this workshop. One of those was the issue of appropriate opioid analgesic prescribing practices by dentists in Canada. And it was agreed that the use of opioids by dentists for either acute, such as primary or postoperative pain, or chronic orofacial pain, is not very well understood or documented. And we wanted to bring together experts in the field to discuss these issues. So to that end, we have invited 3 international experts to talk about the evidence. Brian Cairns from UBC, the Division of Pharmaceutical Sciences, Arlette Colta, who's a neuroscientist from University of Montreal, and Benedict Fisher from University of Toronto is a CIHR chair in substance abuse.
And what will attendees learn at your session?
Well, I hope they'll learn a number of things. I mean, one of the things they're going to learn about is a refresher on the basic mechanisms of pain, which is always important when you're thinking about what's the most appropriate analgesic to prescribe for a particular situation. You know, one of the important reasons for this session is that opioid addiction in and of itself is the fastest growing addiction problem in our country. And we know from American research that about 12% of all opioid analgesic prescriptions are written by dentists. And that's just slightly higher than the amount written by family physicians. We don't think that's much different in Canada. And we also know that most people are exposed to opioids when they're teenagers after having third molar surgery. While it's important to make sure that we manage pain well in order to facilitate comfort and enable the appropriate healing, often these medications can be misused by a minority of people. We want to make sure that dentists understand how to prescribe opioids in a safe and structured manner. In addition to sort of acute and postoperative pain, we know that about 1 in 5 Canadians suffer from chronic pain, and many of these will seek help in a dental office. Narcotics are, you know, an attractive alternative for this group, despite the fact that it might not always be the most appropriate therapy. And an interesting fact is that we have data that shows that Canada is the second largest per capita consumer of prescription opioids in the world. This leads to the issue of misuse. And many people, and not that there's a majority of people, but the minority who misuse these drugs often get them from a friend or a family member who have leftover prescriptions. And we've all heard the tragic stories of people, particularly young people, who have mixed oxycodone, for example, with other drugs or alcohol, and the tragic results of those combinations. So I think it's important that we understand how to identify people who might be at risk for misuse of these drugs, as well as the most appropriate way to prescribe them.
It sounds like a very important and interesting session. And I would like to issue an invitation to you and to panel members that you capture the questions that get posed by attendees on the day. And I invite you and the panel members to come back after the conference and share some of the knowledge that gets transmitted in that room at the PDC.
We would be delighted to do so. And, you know, if there are questions that people have that they want brought forth and they're not able to attend, you know, I would like to know those questions so that we can bring them up in the session.
So we will invite dentists through this post to submit questions. That
would be fabulous.
I think this is a really nice example of CDA through Oasis working closely with the network. We're very proud of that association.
Well, and we're delighted, you know, to be provided this opportunity. You know, CDA has been a very strong partner for oral health research in Canada over the years, and continues to do so. And this is just one example of how we can work well together between the two disciplines of clinical dentistry and research.
Right.
As you know, that's sort of one of the mandates of NCOHR is to ensure that we have appropriate knowledge translation, taking the new information and the new data that we as researchers find and making it easily accessible for the people who are going to apply that new knowledge, the clinicians, the oral healthcare workers.
Lovely. Any other particular highlights about what the network is up to these days?
Well, the network is, you know, privileged to be able to provide some funding opportunities that allow us to do sort of a couple of things. One is, you know, to build capacity for the future generation of oral health researchers. The face of oral health research is changing and aging across the country, and we would like to be able to invite younger people into this field to help carry our banner forward and to continue the strong presence that we have in the research community internationally. We have workshops in which we invite trainees and people who are interested in continuing with oral research as a career. We try to tie them with new mentors or other support systems that will enable them to carry this out as a career. And secondly, you know, when I was, and many of us were trained in research, you know, we had a very narrow field, a very narrow discipline, and we know in today's funding environment that really that's not going to work very well. We have to think very broadly about how we do our research, how our research might impact or be informed by other disciplines, by other stakeholders such as clinical dentists and hygienists, by patients, by pharmacists, you know, other people who can broaden our, you know, research agenda. So we host team building workshops to help build those new teams and help them be successful in attracting new research funding.
Well, we wish you the best of luck. We keep in close touch, and we look forward to you and the panel members coming back after a successful PDC.
Great. Thank you very much again, John.